Sure. My background is emergency medicine and preventive medicine. And I was recruited to CalOptima to kind of jumpstart our medical management program to make it not just the best in Orange County, not just the best in California, but the best in the United States. So that's kind of our overarching goal. We're very focused on population health to make sure that we try to push down bad diseases, as much as we can. And that's kind of where the idea about the cancer moonshot came from. Sure. I think the numbers are going to really tell the story, but they won't be available probably for a couple of years because it takes a long time to curate the data. But we do know that well baby checks, pap smears, breast exams, colonoscopies, all of the major exams to prevent the relatively easily detectable cancers were way down because people were heeding what the government was saying. The government was saying, stay home. Don't go to the doctor's office because we don't want you to bring in COVID. We want you to stay home and isolate. Well, the unintended consequence is that we do know that people did not go and seek medical care. We know that some people had strokes at home, which may have been able to be treated. We know that people were having cardiac issues, especially in the area of heart failure, where they were not getting adequate treatment by going to an emergency department. They were trying to ride out the storm, so to speak, in their house. So there were definite impacts from the COVID. Numbers will be coming, but I think they're still being curated to make sure they're accurate as possible. Probably even more. And the reason I say that is because we found that people would not go in our underserved communities, would not go to get their COVID vaccinations in large arenas because they were paying attention to the fact you're supposed to stay home. And it was kind of hard for them to sort through that message. So here at CalOptima, we actually put together, with the help of some amazing computer data science, we were able to locate geomapping. Instead of by zip code, they were able to break it down into 54 or 58 census tracts. So we knew where the hotspots were. So then we sent mobile vans to those areas and offered on-the-spot vaccinations. So we were very proactive reaching out into those communities. And according to the University of California, Irvine Medical Center, we were able to substantially impact the spread of the COVID or severe COVID by that immunization outreach. The idea behind that is, well, let me back up a little bit. The estimate for spending on cancer care in the United States right now is around $250 billion. The estimate is by 2030, that's going to be $300 billion. So we all know that in 4 of the relatively easily detectable cancers, so what are those? Breast, cervical, colon, and lung cancer in a certain class of smokers, that if you find it in stage 1, there's a very high likelihood it's a cure. Very high likelihood. Stage 2, less likelihood, but still a high likelihood of cure. You get into stage 3 and stage 4, it's the old classic toothpaste is out of the tube kind of thing. And also the cost is huge. And when you get into stage 4, a lot of times it's a Hail Mary. So it's a real challenge. So we want to, in Orange County, be the geographic area that is the lowest late stage discovery of cancer, meaning stage 3 and stage 4, in those 4 categories of cancers. We want to be the lowest in the country. So what does that mean? Well, what it means is ultimately it decreases cost. For me, having taken care of people, I've had about 140,000 patient encounters in my career, my clinical career. And telling someone they've got cancer, bad cancer, is not for either party, the physician or the patient, a good experience. Telling them they get stage 1 cancer and it's curable, that's a great experience for both parties. By spending this money to push down the late stage discovery of cancer, we're going to also push down emotional and physical pain and suffering. Pain and suffering. That's the whole goal, is to make people have a better experience when it comes to their cancer care. And the way to do that is by discovering it very early. And so we're very focused on that. We've done some baseline research establishing, using the California Cancer Registry, establishing what the baseline is for all of those 4 cancers, stage 1, stage 2, stage 3, stage 4. And we've also, in that information, which comes out of University of California, Irvine, also sliced and diced it by ethnicity and also by insurance category. So commercial, Medicare, Medicaid, and uninsured. And as you might imagine, when you go to the uninsured column, the stages or the stage of cancer discovery starts getting higher in stage 3 and stage 4. So as much as possible, we want to reverse that trend. Well, we're very focused on just improving the care of the entire community. And on this cancer moonshot, the idea is to leverage all of the major players in Orange County. We're going to serve as the lead agency, so to speak, or the lead entity, because we don't hospitalize people. We don't have any conflicts of interest. We have 2 NCI facilities close by in our county. We also have 2 other hospitals that provide substantial cancer care. We want to get them all together to cooperate and have this be a community push down, not just for Medicaid/Medi-Cal members, but for the entire community. And so if we're doing advertising to our community, our particular group of people, maybe we can combine some advertising with those folks so that we can really impact what I like to call the health ethos of Orange County, so that we change the dialogue, we change the discussion. We just did a survey with the Coalition of Community Clinics in Orange County. Literally yesterday, the preliminary data came out. And it was quite shocking. 50% of the female members don't want to talk about breast cancer screening. I mean, that was a shock to me. And then another batch said, well, I don't want to be screened because I'm afraid you might find something. We have to change that dialogue, not just here, but throughout the entire United States, so that the dialogue is get screened, it's okay. And if they find something, you have a much higher chance of a cure. So that's a whole nother piece and a real important piece of what we're trying to do.